This is Talk of the Town, a weekly program featuring community events happening in and around Northeast Michigan, with your host, Nancy Smitham, and get the latest from Alpena Community College with Dr. Don McMaster. And now, today's Talk of the Town.
Good morning and welcome to Talk of the Town. I'm Nancy Smitham. My first guest today is Mike Maturn from Catholic Human Services. Good morning. How are you today?
Good morning, Nancy. Thank you for having me. I'm fantastic. Thank you.
Thank you for being here. And as is everywhere else in the whole entire world, I'm certain that Catholic Human Services had to adapt to, I don't know if you want to call it normal, but the new situation in our world and our lives. And I've been seeing all the things come across by email. I know you're staying very active, still reaching out to the people that you serve. So give me an idea of some of the services that you do provide.
Sure. Things definitely have changed. We have done largely all of our work face-to-face in the community with our clinicians and things like that. But now with this new world of COVID, we have had to become very malleable, and we've had to adapt. We have basically three major things going on. One is our clinical services, which offers things such as substance use disorder counseling, mental health counseling. We also do some adoptions. And then we have our family support staff, which works in the homes with families and children. And then we have what we call our prevention end, which the initiative is called Up North Prevention. And we are specialists in education on substance use disorder, drug trends, and things like that. And we spend our time in the schools, out in the community with civic groups, giving talks and educating on things like the opioid crisis and marijuana and all of the other things that deal with, the substance use. The adaptations we've had to make, of course, I have made my living for the last while with Catholic Human Services out in the community in large and small groups of people. We've had to curtail that, of course, because of COVID. Right. So we've learned to use things such as Zoom and FaceTime and Facebook Live, Google Meet, things like that in order to have our meetings. Now, some groups have stopped meeting altogether. And I'm actually working later this afternoon with one on getting them set up on Zoom meetings so that we can resume. Good. Because these organizations all do great work, things such as child abuse prevention and suicide prevention, and we don't want those groups to stop meeting. So I offer technical assistance for things like that, and so do my co-workers in Up North Prevention. We cover 14 of the 21 counties of northern Michigan. Wow. I personally have 3 counties, and I work a lot in the schools, which of course in the summertime we don't do, but from I think probably about mid-March is when I stopped going into the schools, and we're looking forward to getting back with the schools, but we're going to have to see what that looks like.
I know it'll look different, but I remember towards the end you were talking about some wonderful programs you were doing in the schools, and you were reaching so many students and letting them know that no, e-cigarettes aren't safe, letting them know the dangers of marijuana. Just because it's legal doesn't mean you can use it, and the substance abuse and education that they can take home to the parents also. I mean, I'm sad that that stopped, and I'll be anxious when you get back in the schools again.
Me too, and I think we were able to get that message out there, and some of our co-workers have been doing youth group type things via Zoom. Those kinds of things have been helpful, and we're continually working to grow our capacity to do that. We want to do more and more of that because we can actually expand our reach. Even after the COVID crisis has gone by, we can continue using those platforms to expand our reach in the communities and kind of be a little bit more efficient. So I think that will be good. I do look forward to getting back in and doing some instruction with the students, teaching the teachers, getting back into talking about the vape campaign, because especially with the COVID crisis that's hurting your lungs, if you're vaping, smoking cigarettes, or anything that's damaging your lungs, that makes you much more susceptible to possible harm from COVID. So we want to get that message out there as well.
And then how do you get your referrals, Michael? You mentioned substance abuse counseling, mental health counseling. How do you get those referrals?
Well, they come through the drug court. They come through personal physicians reaching out to us, and people just realizing they need help and calling. And we encourage anyone that thinks they would need those services to call our number. It's 356-6385. That gets you to our local office here in Alpena, and then they can kind of speak with you to determine what would work best for you, and then we can get things set up. I do also want to mention that right now we're also offering special services for what I call the hometown heroes, those that are on the front lines in the medical field and are essential workers, because this can be a very stressful time for them. They're hitting face to face. My own daughter works in a nursing home, and so it's very stressful because you're facing this stuff head on every day. And so we want to let those folks know that we do have services available, you know, for trauma experiences and stress and things like that, that we can help with those kinds of things.
And now, does insurance cover any of the fees from your agency?
Insurances do. We bill most insurances, or many insurances, I should say. And with the telehealth, many of the insurance companies have adapted to allow that as a billable thing. And we're doing a lot of telehealth work with telephone, Zoom, and all of those issues. So I think you know, we're still providing services. We still want to be a help to the community, and we want the folks to know that we're there. We're there for you, and we're there for them when they need us.
Well, and I hope that someone will call you, or people will call you, and take advantage of some of those wonderful online things that I've been seeing come out. I mean, they're pretty interesting and pretty informative, and easy to follow and easy to do. So, and they're really good, and it shows alternatives and shows that someone out there does care through these times, and you don't want to help you with all of your addictions or issues that you have.
Absolutely. This is a tough time for everybody.
Yes, it is.
And especially for those that were already struggling beforehand, this just makes it harder and harder. So we want to provide those services to anybody and everybody that really need them.
Okay, and the best way to reach you or someone from your office is at the number that you're going to give us again.
At that number, 989-356-6385.
Okay, and what about a website? Do you have a website, Mike?
Ours for Up North Prevention is upnorthprevention.com.
Okay.
And we're also on Facebook.
Okay.
And we encourage people to go look up North Prevention on Facebook, like it, follow the discussions on there. There's all kinds of good information available there as well.
Okay, well, thank you so much for being here, and you know, much thanks to you and the staff for, you know, being on those front lines too, and doing what you're doing.
It's our pleasure.
Thank you.
Thank you, Nancy.
I'll be right back with Joe Gentry from United Way following these messages. Hi, welcome back. I'm with Joe Gentry from United Way of Northern Michigan. Hi, Joe.
Hi, Nancy.
As we talked to our previous guests about how things are changing in our world everywhere, there's a new normal, if that's even a term we can use anymore, but what's happening with United Way worldwide?
Well, we are a member of United Way Worldwide. It's the trademark that we get to use. They're through many countries now, not just the United States, although their primary focus is primarily United States, and developing countries. But United Way Worldwide, like every organization, is going through transformation, and they're talking about this digital transformation. Traditionally, United Way's funding and focus was to do fundraising through employer-sponsored employee campaigns, where you go in and you make your presentation, encourage employees to give $1 a paycheck or $2 a paycheck or whatever they could afford. And traditionally, that was about 70% of our fundraising capacity. Today, it's about 30%.
Wow.
So you have to rethink your purpose, your vision, and what you're doing. We know the need of what we're able to do is there. We just need to have this digital transformation and to become less focused on supporting organizations and responding to causes, and less focused on employees and more focused on corporate sponsors and individual participation through volunteers, whether it's financial volunteer or feet on the grounds volunteers. So it's a challenge because we're being transformed into a new way to do what we do.
Now, speaking of feet on the ground, you've recently raised a bunch of money and done some wonderful things in our community that maybe people don't know about.
Yes, when the pandemic hit, and it was spurred on by some very generous corporate sponsors. Meyer, because we have a store in Alpena, sent us a $13,000 check because
Wow.
they're huge corporate sponsors with United Way. And they did that in every locale where they had a store. Community Financial sent us a generous check because they have branches in Montmorency County.
Yes, they do.
And that's one of our service areas. DTE Foundation sent us sponsorship check. Consumers Energy Foundation sent us sponsorship checks. The local Community Foundation in Northern Michigan sent us funding through their Urgent Needs Fund, knowing that we were able to get funding and programs to meet the emergency needs into the hands of the frontline people. To date, we've raised about $55,000, but in the last 60 days, we've been able to distribute almost $35,000 of that to meet those frontline needs.
I like that.
In the community. And it's just not food needs, even though that's the biggest need right now. It's personal protective equipment for essential workplaces that they had to provide that. So we're providing the funding and the sources to get that, get those PPEs. So it's kind of a broad reach. We were able to provide money to pay for people's deductibles that were undergoing telecommuting and telemedicine.
Okay.
We provided phone cards and transportation cards for people in need that now had to come to their appointments. So the needs are varied, and we feel pretty proud of the fact that we're able to respond immediately and get the funding to the frontline people as it's needed.
And you know, obviously those frontline people are still going to be out there for a while. Do you still have funding available to help people?
We do, and I'd like to have told people this, and we've had lots of conversations, that the next tsunami of need is coming. Right now it's basically food needs and food necessity. The next one's going to be utility assistance and rent and mortgage assistance, because under the governor's executive orders, shut-off notices, eviction notices have been delayed. But the need to pay those bills hasn't gone away. Just that the suppliers of those aren't able to shut it off. And once those eviction notices and shut-off notices start to come forward, there's going to be a huge need to meet those needs in the public. So I call it, that's the tsunami in July and August, that intermediate need that's going to surface that we need to be prepared to help people out.
Now, do you work with other agencies in our community, Joe, so there's not redundancy, so that?
We do. We have 12, this year we have 12 partner agencies.
Okay.
We're going through at our annual meeting next week, we're going to, in our June board meeting, we're going to review 18 applications from agencies for 2021. But yes, the 12 agencies include the Boys Club, Salvation Army,
Hope Shores Alliance?
Yeah, Hope Shores Alliance, the Alzheimer's Association, Red Cross. Those are essential agencies and organizations that apply for annual funding. And we have still maintained their funding because even though their ability to deliver their services has changed, the need's still there and they're still meeting those needs. So.
And you know, I know the United Way has been so important in our community for so many years. I remember when I used to do fundraising for an organization, they said, Nancy, do not do any fundraising during the United Way campaign or you're going to get people upset with you. I mean, and those are like not written, but they're set in stone. Those are rules because the United Way does spread the money and does, you know, such good work with the money, and then the partner agencies use that money to do even more good.
Yes, they do. We run our campaign generally from Labor Day to the end of the year. That's our main focus of the campaign. But this digital transformation that the United Way Worldwide, it's becoming more of an annual campaign where you do a small focus, but it's an annual campaign to raise money to support the agencies that you're working with. One of the other focuses we're doing is we're becoming more of a service provider, not just find those agencies that have needs and partnering with agencies, such as our Gear Up program. We work with APS to identify, and the student success workers to identify students in need, and we provided last year 36 students a $200 shopping trip to
Wow.
purchase clothing and shoes to be prepared for school. Part of Gear Up was Stuff the Bus, where we encourage people to donate school supplies that went into backpacks that were provided to the school success workers to provide to students in need. So we're becoming an agency that sees a gap, and we're trying to provide to meet that gap as a direct service agency instead of a pass-through agency.
Well, you know, that's kind of cool. I always say, like Salvation Army, you know they're there all the time, but you only see them during the holiday season. United Way, you know they're there and they're behind the scenes doing a lot of good, but you only see them during the campaign time. So that's really interesting and a good fact to know that, you know, you're really out there year-round doing lots of good things in our community.
One of the things that people don't know about is through FEMA. FEMA allocates annually money directly to counties through what's called the Emergency Food and Shelter Program to be distributed to those agencies that are meeting emergency food and shelter needs. This year, in Phase 37, just a month ago, $17,000 was allocated through the CARES Act through EFSP, and an additional $12,500 was under Phase 37. So we were able to, and we're the administrators of that, to get $30,000 additional dollars out to agencies that are meeting emergency
Wow.
food and shelter needs. Primarily went to NEMSCA, who is providing and meeting the emergency housing needs for homeless people,
Right.
and for Hope Shores Alliance in Alpena County. Mount Morency and Alcona will get funding from the state set-aside committee.
Okay, we're going to take a short break right now. We'll be right back.
Thank you.
Please stay tuned. We'll be right back. Hi, welcome back. I'm with Joe Gentry from the United Way. So Joe, I know one of the focuses of United Way is the ALICE population. Can you explain that to me?
ALICE is an acronym that stands for Asset Limited Income Constrained Employed.
Okay.
Which means I'm a working person, I have limited assets, and my income doesn't allow me to really support my household based on what is needed to support a household, whether I'm single or I have a household family of
Right.
3 or 4 people. And there are standards that are set that they talk about 6 metrics that they measure that people need to have income to support: food, shelter, transportation, health care, child care and education, taxes. So if you look at all of those, you know, and they say the federal poverty level is like $12,000 for a single individual, and it's $24,000 for a family of 4. The ALICE household income needed to meet those 6 metrics is more like $20,000 if you're a single person, and $60,000 if you have a household of 4 with 1 preschool and 1 child in school.
I can't imagine how families do it when both people work and they make minimum wage and maybe don't have insurance or have to pay a lot towards their insurance. Just the regular stuff. Then when the water heater breaks down and the furnace breaks down, the car breaks down, you know, all those things that how do you plan for that? How do you save for that with that income?
And you don't have, and so then you start making choices. Do we
Right.
eat today? Do I provide, you know?
Do I get my medicine?
Do I fix my car? Or, and it's an issue. So we have, in Alpena County, you have 44% of the population falls within the ALICE population. And that includes, in that ALICE population, that also includes those households that are falling below the federal poverty level too.
Okay.
So, but you lump them all together, that's 44% of our population don't have a household income enough to meet basic needs to get by successfully in society. You look at Mount Morency, 52%.
Wow.
State average is 40% in Michigan. So the goal of the United Way has been to address those issues from an education standpoint, and to address those issues from the agencies that we're supporting that are trying to bring about change to improve equity. Whether it's from a policy standpoint, trying to have the earned income tax credit boosted, because that helps. That lowers
Yes.
one of the metrics for people. And so our focus has been to educate people about the ALICE populations in our community, and to try to change policy, try to change take for instance, the governor's 60 by 30. She has a program that would like to have 60% of Michigan's population have a certificate or a degree beyond the high school level by 2030. So if you look at that and do the math, if I'm trying to make people successful in 2030, I need to be supporting the education that's going on for people that are going to be 18 and 20 and 21 in 2030. So I want to support the programs that NEMSCA has, like Great Start Collaborative,
Yes.
Power of Parenting, that are helping families to improve their life positions and to improve their income status. So that's become kind of our focus, and when you look at our partner agencies, those are some of the agencies that we currently support, like the Power of Parenting and the Great Start Collaboratives. So it's a different focus than just food needs, housing needs, shelter needs, even those are very important.
And Joe, the statistics that are out there with the COVID show that the disadvantaged people have a higher incidence of having COVID.
Well, and the result of what's going on today, unfortunately, and I'm not talking to the violence, but the protest about these lower income, medium, minority people who are suffering because, frankly, that's a large part of the Alice population.
Mm-hmm.
If you look throughout Michigan, even the high income counties still have the highest rates of poverty because of minority populations. And so it's manifesting itself. The Alice population problem is manifesting itself through the fact that if you look at COVID, 33% of our COVID infected people in the state of Michigan are minorities, but yet they only make up 17% of the population, which means they're lower income, they don't have access to health care, and so that disadvantage puts them more at risk, and the statistics are proving that out.
And you know, Joe, I think too of a senior population because, you know, if a person's elderly and, you know, people are definitely living longer and they're living alone in their own home and they get a bill from a doctor or they have healthcare concerns, you know, for them to access the healthcare and what they need right now, it's just mind-boggling and baffling. I know how hard it is for me if I get a bill from a doctor and I don't understand it, but you know, I'm glad there's people like NEMSCA out there help people navigate through those things too, and Alpena Senior Center does too.
The Alpena Senior Center, that's another one of our partner agencies. They do a great job.
They do.
We've been able to help the both Montmorency Commission on Aging and the Alcona Commission on Aging, which are equivalent to the Alpena Senior Center, that do a great job of meeting senior needs. And the other problem with the Alice population, it's growing because, as you know, a major part of our population is becoming the senior population.
Yes, it is.
Many of them are on fixed income.
Mm-hmm.
And that fixed income throws them into that the Alice population where they're making decisions. Do I eat or do I pay for my medication?
Yep.
And it's becoming more and more difficult. Healthcare expenses are not diminishing.
No.
Insurance costs are going up. And so those are issues that United Way is trying to focus in on and help people.
Okay, so now usually every year, as we talked earlier, you have a big campaign and you do all those wonderful things, and Bruce Anschutz and Jamie and Steve and Ellison, they've been out there and about. So this year, do we have any plans? We do have plans. I'm waiting for a response. We've had someone we've identified that we'd really like to encourage to be our campaign chamber. Our campaign's going to change a lot this year because of probably be a lot of virtual campaigning because of the social distancing issue, but we still want to move forward with it, and we want to find somebody high profile the community trusts, and yeah, we're working on that. Very good. We hope to have an answer this week. Yay, well, we'll be looking for that. So Joe, we are out of time. I want to thank you so much for being here and enlightening us on all the wonderful things about United Way. Now, if someone's interested in some of those grant dollars that you still have available, what's the best way to reach you? You can call us at 354-2221 and provide us an email, and I will send them applications, or they can just Google us, United Way at Northeast Michigan, and on our website is a link to fill out the application, and just go COVID or emergency response link and just click the button
And but if you have any problems, just give us a call.
Thank you so very much.
Thank you, Nancy.
Thank all of you, and please stay safe.
This has been Talk of the Town with your host, Nancy Smitham and Dr. Don McMaster. For a list of community events taking place in Northeast Michigan, please visit our website at wbkb11.com and click on our community link. This has been a Thunder Bay Broadcasting Corporation production.